Hey y'all, it's Erin the DPT here. And as I stated last week, if you didn't know, October is Physical Therapy Month. And in honor of Physical Therapy Month, I'm going to be doing a segment called Ask the PT. So I asked everyone to either leave me a comment or to message me about a question that they have in regards to PT. And I'll be answering the first question today. So the first question that I was asked was talking about arthritis in your shoulders and basically what are the best ways to treat arthritis. So before I answer the question, let's talk a little bit about what arthritis is. So if you kind of break down the word arthritis, you basically have the arth and then you have the itis, meaning arth is meaning like anything pertaining to a joint. Itis is basically inflammation. So that's what arthritis is basically inflammation or swelling of a joint. Okay, so that's arthritis. I know you've probably heard of osteoarthritis. Some people have that in different parts of their body. And if you break down that meaning of osteoarthritis, osteo means bone. So that's basically a lot of times when people hear the term, then they say, oh, it's bone on bone. That's the type of arthritis they're talking about in that instance. But basically going back to the question, a lot of times with arthritis, the biggest thing is that you want to keep the joint moving. Right? You want to keep it moving because a lot of times you probably heard the term, if you don't use it, you lose it. But again, you want to do this safely. So that's why I said if you're having arthritis, definitely in different parts of your body, I would definitely reach out to your doctor. Just talk to him about different things that they would recommend, but also seek a physical therapist. I've seen a lot of patients with arthritis, and what we do is a lot of times we do a range of motion. Basically, we get the joint moving better in the way that it should be moving to help to decrease some of your pain. We also do a lot of like soft tissue hands-on treatment. Because a lot of times if the joint isn't moving correctly, a lot of the muscles and the tissues around it get tight because they're not moving the way they should be moving. So we do a lot of hands-on technique and soft tissue to help to get those muscles to start relaxing. Also, we do a lot of strength training because what can happen is that even though you have, that inflammation of that joint, that you want to make sure all the muscles and everything around the joint are functioning properly. So a lot of times if you don't use it, you lose it, those muscles tend to get weak. So we also do appropriate strength training to help build those muscles back up. So that is my tip for that is one, reach out to your doctor, talk with them, reach out to a physical therapist, and they'll set you up on an appropriate plan to help treat the arthritis, including appropriate range of motion exercises, strength exercises, soft tissue hands-on treatment that can help address your arthritis, get you moving better, and help to may not eliminate it, but help to decrease your pain. Alrighty, y'all, that's my Ask the PT segment. I hope you all get out and get moving, and I'll see you all next week. Have a great weekend.